My name is Dr. Tayal. Pleased to meet you. I've been asked to take a history and examine you, if that's okay. So do you want to run me through what was the main symptoms, what was the main complaints?
The main problem that I have is stiffness, which occurs in my neck and my lower back mostly. Because of the fact that I cannot stand straight or lie straight.
Right.
I get associated pain with stress. If I have to stand on my feet for a long time, then I will get pains in my lower back because of the muscles are taking the weight rather than than my back itself, which makes long distance walking a problem.
Right, okay. So you've got stiffness in your back and neck as well.
Yes.
And how long have you had these symptoms for?
5 years, but I suspect that I was beginning to develop this condition for some period of time before that.
Right.
But it's in recent times has become much less manageable.
Right. Now, obviously, this must be having some effect on your life. I just wanted to check with you, how is it affecting you? Daily things like washing, cooking.
Washing, cooking, for me that isn't a problem. Going out shopping, it's fine for short periods of time, but if I'm on my feet in the shops for a long period of time, then I will experience lower back pain.
Have you had any redness in your eyes, either recently or in the past?
I haven't had any redness in my eyes.
Do you have any bowel problems?
None at all.
No. Any rash?
No.
No. Okay. Do you have any previous medical problems apart from the stiffness and pain?
No.
No. Do you have any psoriasis?
Have occasional patch. I have a tiny patch of dry skin around here.
What about inflammatory bowel disease? Have you had any?
None at all.
No.
I'm very regular and absolutely no problems.
Is there any family history where your siblings have had the same sort of symptoms as you have?
My father had some problem with his back, which he didn't ever go to the doctor with, so far as I'm aware, but it was noticeable that from the time he was about 55-ish, he couldn't drive and turn to see what was behind to any great extent, and had to rely excessively on mirrors. And now I'm doing exactly the same thing. So I suspect that there might be some family history involved in this for him.
Now, just run me through what medications are you on?
Ibuprofen tablets as a general background anti-inflammatory.
Well, thank you so much for the information. What I'm going to do is to have a look at you to get some bit more information, if that's okay. Okay?
Fine.
Right, Mr. Smith, I'm just going to have a look at yourself from sides and from the back. I'll ask you to walk a few steps and back and just take a few steps forward for me and turn around for me. And again. Okay, if you just turn to me there. Right. I just need to check your neck movements now. Can you show me how much you can move your neck, front and back and side to side? To side? And that way? That's the maximum you can do. I'm just going to measure your back movements now. Now, could I ask you to bend as far as possible for me, please? Okay, thank you. Now, Mr. Smith, can you just move your back side to side like that?
Very limited.
Okay. Yeah. I'm just going to check your chest expansion now. Okay. Take a deep breath for me. And out. Okay. Are you able to just walk up to the wall?
Yes.
Could you just stand close to the wall with your feet close to the wall and try and touch your head on the wall, please?
That's as near as I can get.
Okay. Just going to listen to your chest now. If you just stand there for me, please. Deep breath in and out, please. And again. And again. Listening to your story and examining you, your symptoms and your signs are compatible with what we call ankylosing spondylitis. I'm not sure how much you're aware of this, but this is a condition where there is excessive inflammation and stiffness in the neck, back, and also sometimes the large joints of feet and knees as well, and which over a long period of time can calcify and cause loss of restriction of movements.
Okay, you have 2 minutes remaining.
Now it appears that from your story, although you have pain and stiffness, your daily activity is not that restricted, which is always a good news. Apart from painkillers, have you had any physiotherapy, or because that sometimes helps with the condition?
I have had some physiotherapy.
Physiotherapy,
yes.
Yeah, okay. So the basic, the way we usually manage this condition is physiotherapy, education, exercise. Hydrotherapy is very beneficial in some cases. We'll have to do some investigations to check for current activity of the disease and see if there is active inflammation going on. We may have to do some x-rays of your back and after this we can take it forward. Do you have any questions or concerns at this moment?
Will I need hospital treatment?
Well, I don't think you need to be in the hospital as such, because you're otherwise well, and this is a long-standing condition, and I'm afraid we're not going to do anything acutely to help this, and a lot depends upon what the investigations show. If there is calcification and permanent stiffness, I'm afraid we won't be able to reverse it, but depending on the active inflammation, we may do something about it.
Is there any treatment that I should be taking in terms of types of treatment?
As I said, the treatment for acute pain is non-steroidals, which you're taking ibuprofen. If we find a lot of active inflammation going on, we do have certain treatments which we have available, but then we have to make sure that you merit those treatments, because those treatments have their own risks. So a lot will depend upon how much of your disease is currently active and how much it is irreversible damage already been done.
I see.
Okay, thank you so much.
Thanks, doctor.
Okay, so could you tell us your findings?
This patient had a severe restriction of movements of his neck and spine. His posture was stiff stoop question mark posture with loss of lumbar lordosis and thoracic kyphosis. As I said, his neck movements were extremely limited. His wall occiput test was positive. He was unable to approximate his occiput on the wall. He has limited motion of his spine flexion, which was about 2 centimeters. His chest expansion is reduced at 1.5 centimeters. There is no evidence of apical fibrosis. My diagnosis for this gentleman is ankylosing spondylitis. I would like to look for further signs of aortic regurgitation in this patient.
What other features would you expect to see in ankylosing spondylitis?
Other features which can be present are enthesitis, aortitis with aortic regurgitation. They can have apical pulmonary fibrosis. Sometimes they can have recurrent anterior uveitis, atrioventricular blocks, and also they can have peripheral large joint arthritis. Usually a diagnosis of ankylosing spondylitis is fairly obvious. If you're suspecting a patient coming with low back pain, restriction of movements, the first thing is usually check the gait and check how he's walking, and the diagnosis will be obvious. Look at the patient from the side to demonstrate to the examiners that you're checking the posture the loss of lumbar lordosis, and then go on to the neck movements and spine movements. In the neck movements, one of the tests is the wall occiput test, to ask the patient and see the distance between the wall and the occiput. And then modified Schober's test is essential to perform with an inch tape and make the measurements. And then quickly check for apical fibrosis, aortic regurgitation, to demonstrate the knowledge of other tests, basically. The questions which might arise from these are, what are the other signs and how would you manage this patient? And the management has to be divided into a multidisciplinary approach: education, physiotherapy, hydrotherapy. For peripheral joint arthritis, you have the non-steroidals, the methotrexate, and also for resistant disease, we have the biologic treatment.